This video provides guide respite care training for caregivers who are going to be working within the guide program. Within this training, we will talk about what the guide program is. We'll talk about dementia and the type of care that needs to be provided, as well as some other topics related to safety and to communication. This training is important to ensure that every caregiver who's providing respite care within the guide program maintains a consistent standard of high quality care. In order to work as a caregiver within the guide program, a caregiver must be 18 years of age or older, must pass a criminal background check, and must complete this program and pass the assessment at the end. During the program, we're going to talk about dementia and respite care, about the type of daily support that individuals with dementia need, about safety and first aid, elder protection, and some communication strategies. Dementia is a progressive brain syndrome causing decline in memory, thinking, behavior. It affects more than 6 million Americans and leads to increasing care needs. Alzheimer's disease is the most common form, but there are many types of dementia, including vascular dementia, Lewy body dementia, and frontotemporal disorders. Dementia often co-occurs with other chronic conditions, such as diabetes, heart disease, and arthritis, making care particularly complex. Individuals with dementia progress through several stages. During the early mild stages, you may see memory lapses or difficulty finding words or finding objects and slight personality changes. Often individuals still function independently, but they begin to struggle with more complex tasks. During the moderate stage, there's increased confusion, sometimes difficulty recognizing family members, and maybe they need more assistance with their daily activities. You might begin to see wandering or the repetitive questioning and more significant behavior changes. During the final and severe stages of dementia, the individuals will lose their basic functions, their ability to communicate. They may not recognize loved ones at all or very rarely. And during this stage, the severe stage, they may begin to require 24/7 supervision. While everyone is different, there are some common behavioral symptoms in dementia, including agitation and restlessness, wandering or exit seeking, confusion and disorientation, and sundowning, which is an increased confusion or anxiety late in the afternoon or evening. These behaviors are not intentional, but are expressions of unmet needs, frustration, or brain changes. While they can be challenging, there are strategies that work to help managing these behaviors. Most importantly, remain calm and reassuring. Your emotional state affects theirs, so speak softly, move slowly, and maintain a calm demeanor even when behaviors are difficult. Try to redirect their attention. Instead of confronting or arguing, gently shift their focus to a favorite activity or topic or memory that brings them comfort. Maintain their routines, follow the schedule for meals and medications and toileting and rest to help reduce confusion and anxiety. Make sure their basic needs are met. Sometimes the behaviors come out because they're hungry or thirsty or in pain or need the restroom. They can't express these needs, so they come out in different ways. And finally, don't argue with them. Validate their feelings. Even when what they're saying doesn't make sense, the emotions behind it are real, and we need to acknowledge those emotions. You seem worried, and provide reassurance. Everything is going to be okay. So, what is respite care? It's a temporary relief for the primary family caregiver by transferring the care to one of you so the family can take a break. It gives the family caregiver short breaks to rest or attend to their personal needs. Research has shown that respite breaks benefit both the caregivers and the clients. Respite becomes necessary when family caregivers begin to get exhausted or emotionally burned out, when they're neglecting their own needs and their own self care, or just when they have personal obligations they have to attend to. Within the guide model, there are several types of respite services available. The one we're involved with is called in home respite. That's where a qualified caregiver, like you, goes into their home and takes over their care so the family member can leave and get a break. There are other options within the model, such as adult day centers and overnight facility respite as well. But we're focused here on in home respite. Our role as respite providers is to ensure the safety and comfort of the clients, to take care of their basic personal needs, such as toileting and bathing, dressing, eating, etc., to maintain their routines so they don't become confused, and to try to engage and stimulate them with activities that they can relate to, looking at photos, listening to their music, gentle exercise, and the like. The activities that we support every day include those things that require hands-on support. These are called activities of daily living, ADLs. And these are things like bathing, dressing, toileting, eating, which means actually getting food to their mouth, and transferring them, for example, from a bed to a wheelchair. These all require hands-on touch, and they're called ADLs, activities of daily living. We can also help with instrumental activities. These are things that support them but don't require physical assistance to them directly. Things like preparing a meal or doing housekeeping. It's also important to keep them exactly on their medication schedule while we're filling in for the family. At times, we may be called upon to provide basic first aid, applying band-aids, for example, or assisting with minor falls if there's no injury. For more severe situations, we're going to get professional help. If a client becomes injured or becomes unresponsive, call 911 immediately and follow the dispatcher's instructions. If you are trained and certified in CPR, you may perform it, but otherwise do not perform CPR without a certification. And of course, notify the family and the office. It's always good to take safety precautions around the home to make sure there's adequate lighting, that hazardous chemicals are stored in an inaccessible place, that pathways are clear, that grab bars are in place. If you see home situations that you feel need improvement, notify the office. And of course, we want to prevent wandering. Many clients with dementia tend to wander. They'll start to talk about going home or going to work, or they'll become restless. Um, if a client does manage to wander off, and of course you want to prevent that, then notify the office right away and we'll assist you with instructions. It's also our obligation to prevent and to report any elder abuse or neglect that we think is occurring. So if you think anyone is harming one of your clients, always notify us immediately. When communicating with clients with dementia, the tone and approach you use is so important. Approach them from the front, Establish eye contact, speak slowly in a gentle voice, and use short, simple sentences. Listen to them, not just the words they're saying, but the feelings that they're having, and respond with comfort and reassurance. Use friendly facial expressions and gentle touch to convey care and support. Sometimes visual aids can help, picture cards, for example. And many clients who have difficulty communicating with speech still find music and singing to be a comforting element in their lives, especially songs from their younger days or their childhood. And of course, as with all clients, we want to be aware of their cultural background and make sure that we're being sensitive to their cultural interests. So, upon completion of this training and passing the assessment, which you'll take in a minute, you will receive a certificate of completion. The office will be notified and will maintain a copy for your records, but you will also get an email if you want to print it out yourself. Thank you for completing this training. Once you have finished watching this video, you may click the button to begin taking the assessment.